This morning we are learning about a very important tool at Marquette Medical Urgent Care. Joining us in the studio, we have Dr. Sean Brown and we have Amanda, who is a nurse there. Thank you both for being here this morning.
Thank you so much for having us.
Yes, and so this very important resource that the community should know about is regarding sexual assault, correct?
That's right. So we operate the Sexual Assault Nurse Forensic Program. We're now celebrating our first full year of operations in conjunction with the Women's Center of Marquette.
Wow, congratulations on that. And I mean, it's obviously a very important tool to have. You know, unfortunately, it's something that happens in every community. And so why did you, a year ago implement this here?
So when we opened Marquette Medical Urgent Care, it was to address the deficits of medical care in the community. And one of the big things that we've noticed is that myself as an emergency medicine physician, I've seen patients come in through the emergency department to address sexual assault concerns. They're using the emergency department because that's the standard of care nationwide. It's the only place that's open 24/7 and available for patients when we need that time-sensitive forensic material collected. But it's just not the right environment for them. So it's loud, it's chaotic, it's designed for acute triage and stabilization, not for longer trauma-informed, slow and quiet care, which is what we're able to provide through the urgent care.
For sure, yes, and there is very specific training that goes into this, right?
Correct, yes. So actually I just went downstate and had completed my formalized training where a couple colleagues and I had done a 7-week didactic course online where we did case reviews, studies, and we also just met with a group of nurses throughout Michigan. And then we just went downstate to complete a 3-day, 8-hour, 9-hour day training with simulation, live models where you got to practice swabbing, pelvic exams, other genital exams, taking pictures, everything like that. So we've had some in-depth training, which is good. It focused on adolescents and adults primarily. But we're focusing also on doing our pediatric training, a couple of us, this coming winter.
Oh, wow. Yeah. And so, I mean, obviously it's a very, uncomfortable time for anybody going through that. Can you kind of explain some of the tools that you have here today to kind of explain what the process is like?
Sure. So typically what happens is that there's a nurse and a doctor or a provider on call, and the Women's Center will call us and let us know that an assault occurred. Our criteria is, for now, it has to occur within 120 hours, so 5 days, and above the age of 13 and older, and they're medically cleared to come on over. From there, they are accompanied by an advocate, which is amazing. I can't thank the Women's Center enough for that, because that's really a huge support and resource for them. They will come on over and the nurse will meet with them. We talk with them first. We just let them know that they're safe, they're in control, this is their exam. They can stop anytime they want. We want to give that power back to our survivors. Then we go through the consent process. We let them know what we can provide, what we can do for them, and it's honestly up to them what they want to do. But here we have our consent forms in here. We start off just by doing a medical history, what occurred, what they want to provide to us, and go from there. Then we have our SANE kit. If they decide to do an evidence collection, we have it right here. It's provided by the state of Michigan, and it will provide to you resources for our SANE patients, as well as different type of swabbing you can do based on what they give you in the history. So it's really nice. It's all in here. There's directions in here. It's easy to use, and it really gets the whole story. And then Sean and our SANE coordinator, Janelle, it was awesome enough to provide little ready-to-use kits for when SANE patients come in, so then we can have our medications for STI prophylactic. We can also do a bunch of STI testing for them, and we send it off to our lab. So we have just nice little components that we can go throughout the SANE exam, and it's completely up to the patient. But we have a lot of resources for them.
Yeah, definitely.
Yeah, and pregnancy prevention.
Correct. Yes, we do have that. So we will do a pregnancy test just to make, see if they're pregnant at the start. But we also have emergency contraception that we can provide, like Ella or Plan B.
Okay, yeah, and
applicable.
definitely something, that people should be aware of that you guys provide. And,
Yes.
as well as partnering with the Women's Center. So every time
Yeah.
there's a case, they get a hold of you. Is that correct?
That is correct. Yep. And an advocate will come with them, and they will provide resources for after discharge as well, whether that's therapy, support groups, peer groups, what have you. They are a huge resource for our community.
For sure, yes. And, like you said, it's been a year. How has it been going so far since having this in the community?
So we've had a really good response from the community, and especially from our partners in law enforcement. That's a key point of contact where a lot of our survivors come through, is that they call 911 first. And our law enforcement partners have been great at making sure that patients are safe to come directly to the urgent care, or if they need some sort of medical clearance, if there's concerns about severe injury or strangulation, they can go to the emergency department first, and as soon as they're medically cleared, they come to us for the remainder of the forensic evidence collection. We've seen 30 patients so far this year. And additional patients we have had contact with but have been more appropriate to go through the emergency department, or those folks under the age of 13. But certainly we are happy to provide that resource to the community.
Yeah, and is there, just out of curiosity, is there a need for more nurses to get this kind of training?
Yes. Yes.
Absolutely.
There is a shortage, a national shortage of SANE nurses. So I would encourage ER nurses, those that are interested, to do it. And I know a lot of nurses don't want to be on call at night. However, it's a needed resource, especially in rural communities, because no one really wants to do that. And I get that, but our community deserves it, and we deserve to provide that resource for them.
For sure, yes. Is there anything else either of you two would like to add this morning?
I think it's important to look at the nationwide framework for sexual assault programs. So our community is unique in that we're operating out of an urgent care. We're the only one in the country that does it that way. Most of these programs are run out of emergency departments, and like Amanda said, it's really important for other nurses in the hospital to get involved with that, so that it's not taking the resources of what is a finite number of nurses in the ER at nighttime and putting the rest of the community at risk by decreasing that staffing. And there are also some freestanding sexual assault programs downstate that have been doing a phenomenal job of caring for these patients. But the more people that we can get trained in this specific trauma-informed care, the better.
Yes, for sure.
Exactly, and just exactly what Sean said, and then also to our survivors out there, you're not alone, and we are here, and if you need help, if you want to speak to someone, we're here. Our urgent care is open 7 days a week. There's always a SANE nurse on call, so there's someone always there.
Great, yes. Thank you both so much for being here this morning. Really appreciate it.
Yeah, thank you.
Yes, and we'll have all those details for you on our website, myupnow.com. Stay with us, and we'll be right back after the break.